welcome to Talk with the Doc, the show where we bring your questions to Providence medical experts for insight and information. I'm your host, Mary Arnoff, and here with me today is Dr. George Diaz, the infectious diseases hospitalist at Providence Medical Group in Everett, Washington, which is also the site of the first U.S. coronavirus patient. Today we're answering your questions about the coronavirus. Remember, everyone, all of our questions come from our listeners on social media. We can be found on Twitter and Facebook under Providence, and use the hashtag #TalkWithTheDoc for a chance to hear your questions on future episodes. Before we start, I want our listeners to know that the information provided during this program is for educational purposes only, and you should always consult a healthcare provider if you have any questions regarding a medical condition or treatment. This is a special episode of Talk with the Doc based on the overwhelming amount of questions we've received from coronavirus. I want to thank Dr. Diaz for making time so quickly to come and talk with us. So tell us just a little bit about yourself and your role here.
So I'm the section lead for infectious diseases here at Providence Everett. I also am the medical director for antibiotic stewardship at my hospital and work for the health system doing informatics with the Epic group.
That's great. And I know that we've had a few doctors within our system on our show talking about coronavirus, and things have evolved a lot since the very beginning. Can you tell us a little bit how the symptoms have changed and how at first it was non-flu-like symptoms and a temperature, and then it was you weren't going to have a temperature? What should we currently be looking for?
Yeah, so they're still fairly similar to what they were before. Smell, fevers with cough, with shortness of breath. And one of the symptoms that we've become more aware of recently that's a little different is the loss of taste. Although that is not a super common symptom, it seems to be pretty specific for the disease. And so when we're advising our caregivers about looking for symptoms, that's actually one of the symptoms we're now including. There can be quite a number of other symptoms that are less common or variable, including sore throat, headaches, muscle aches, etc. But the first four that I mentioned were the ones that we're typically looking for primarily.
Do we know why it affects the sense of taste and smell?
That's a really good question. I think we don't really know. The virus is a virus that primarily infects the nasal passage. And so the nerves that give you the ability to smell reside at the very top part of your nose. And so it's likely that tissue is probably also sometimes gets infected and causes loss of smell. And when you lose smell, oftentimes you also lose taste.
Gotcha. So we had a lot of questions come in, so I'm just going to kind of run through them. But one of them that we got was, if someone catches or thinks they have COVID-19 and live with other people, will staying in one room in isolation be enough to protect the other members of their family?
Yeah, and those are the current CDC recommendations. I think that keeping the person that's infected as isolated as possible within a household makes a lot of sense. We certainly don't want to abandon our family members or loved ones that will need care in case they're sick. So I think it's totally appropriate to have someone in a room while they're ill if possible, and then having the other family members deliver food and other supplies to the person that's sick.
When you talk about food, is there anything, I know a lot of people always say like starve a cold, feed a fever, or vice versa. Is there anything different that we should do when it comes to our eating patterns around COVID?
No, there's nothing really that you need to change in terms of food consumption. We actually see some people actually not want to eat with this infection, and it's important to maintain nutrition to be able to stay strong and fight off an infection. So we certainly encourage people to continue to try to eat and maintain a healthy diet while they're sick.
And is a lot of fluids a good suggestion as well?
Yeah, it's this virus tends to cause fevers quite a bit, and so one of the things that happens when you have high temperatures is you get dehydrated pretty quickly, and so it is important to maintain fluid intake to prevent dehydration that occurs with this.
Wonderful. Well, we hear a lot about people who are high risk patients when it comes to COVID. What qualifies as high risk?
So the primary ones are basically age over 60 or other comorbidities, including cardiac disease or immunosuppression. Other risk factors that appear to be important ones include diabetes, any other cardiac disease, or even we're seeing patients with obesity develop infection more severely than others. And so those are the primary risk factors for severe disease.
And we hear a lot about the elderly, but if you're a fairly healthy elderly person, it's not as concerning as somebody who we consider more to be frail, or like we're seeing a lot of people in nursing homes. Is that accurate?
I think it's a little hard to distinguish between people that are older and frail and people that are just older in general that are not frail. We know that the vast majority of deaths occur in people that are above the age of 60. And so any infection in an elderly person we take very seriously and monitor them closely.
And it is impacting younger people. I know we've seen people who are in there, but even who said that they were runners or fitness or high, or, we're in really good shape. So it doesn't really seem to just impact the elderly. Is everybody at risk?
There's very few deaths below the age of about 30. We see sporadic cases in people that are under the age of 60. They comprise a much smaller number of people that get very, very ill, but it does occur, unfortunately. But the large majority of patients are those that are elderly or have those risk factors for severe disease.
And I know that we've seen a lot of states go into kind of shelter in place, and we've seen people now start to say you have to wear a mask when you go outside, and the CDC has actually recommended it. Are those fabric masks enough? Because people aren't able to find them, so they're making them out of T-shirts and tea towels. Is that going to be enough to help them?
Yeah, so the CDC website has instructions on how to make home cloth masks, and they are recommended for use when people are out in the community, especially things at the grocery store where there's going to be other people. And so, yeah, that does confer some level of protection against infection, and especially in case the person who's wearing it has an infection, will also decrease the chance of that person spreading the disease. So it is being recommended. They're not the same quality as one would have with a surgical mask or a respirator, which are currently being reserved for healthcare professionals in the hospital setting.
Absolutely. And what about re-wearing those masks? Should we be washing them in between? Should we be creating a new one every day?
Yeah, if they get soiled, they can be washed like normal, and you can make additional masks that if they wear out, but they certainly can be reused with normal washing. If you feel that your mask has gotten dirty or it's gotten a little moist or wet, they should be washed.
So let's talk a little bit about vaccines and testing and treatment. It seems like the treatment maybe hasn't evolved as much as we had heard that it had at one time. But are we changing the way that we're treating people now versus when we first got this case a couple months ago?
So we have, thankfully, a centralized research department within Providence St. Joseph Health, and we're participating in a lot of clinical trials right now across our health system. In my particular hospital, we're looking at two therapeutic treatments. One is called with a medicine called remdesivir, and another medication called sirolimus. And those treatments are being studied right now to try to improve the outcomes in people with coronavirus infections. We're hoping and we are expecting that data will come out soon with these trials, and hopefully they'll become at some point FDA approved for use in patients who have severe disease. In the meantime, we are using these at our hospitals. We have a number of other clinical trials within our health system that are being stood up, including one with convalescent plasma that we're interested in as well. So there's a lot of work going within our health system to look at some of these therapeutic agents in a way that we can prove that they work. With respect to vaccines, there's a lot of companies now involved in vaccine development. As Dr. Fauci from the NIH indicated, the time that it takes to prove that a vaccine works and is also safe can take up to a year. And so that's sort of the timeline that we're looking at for vaccines. So in the interim, we're very hopeful that some of these therapeutic agents that we're studying will prove to be effective for this disease.
So if I've already had COVID, can I get it again?
It sort of depends on your immune system. So in all likelihood, the vast majority of people that get COVID infection will be able to generate their own antibodies and prevent reinfection. There are certain persons we know that can't make antibodies very well. So, for example, people with cancer on chemotherapy or HIV or some other reason that one's immune system isn't normal. In those patients, they may not form natural antibodies that will protect them from reinfection. But in the vast majority of patients, I would expect that if you've had it once, it's unlikely that they will get it again.
Is it like the flu where, we got the flu shot, but this year maybe it wasn't as effective because it was mutating and we didn't know? Do we think that COVID-19 will continue to mutate into something else?
I guess it's certainly possible. Coronavirus in general is a little bit different than influenza. Influenza has, I think, a little bit higher propensity to change from year to year. So I think it's a little unknown, but we're hopeful that it doesn't have, that once we develop a vaccine, that it will be effective and that vaccine will be durable in terms of being able to use it from year to year. But I think experience and time will tell.
So I know Everett actually had the first confirmed U.S. case, but do we think that maybe it actually was here earlier and we just were treating it as though it was a flu or cold or something else?
It's possible, although I think it's a little less likely. I think that there's certainly enough people that get coronavirus infections that end up developing pneumonia and get sick and come to the hospital. And one of the areas that the CDC was recommending testing initially was in people where there was no explanation for their pneumonia, and you could test those patients and send samples to CDC very early on. We just didn't see that here locally in terms of cases coming into the hospital. That was, however, the way that the nursing home in Kirkland was identified as a cluster, because there were patients there that were admitted to that nursing home, and they had routine testing that was all negative for common viral illnesses, and so they suspected that that could be a coronavirus infection. But we hadn't seen that sort of phenomenon before our first patient in Everett.
Do we know kind of how accurate the current statistics are? Because are there a lot of people who maybe had it and just didn't know they had it because they weren't feeling symptoms?
Yeah, it's really hard to standardize the number of cases in a community when you don't have widespread testing, and so there still is there are limitations in testing nationwide. Some places have more access to it than others, and so it makes it really hard to know the exact numbers in a population. So some people have argued that rather than looking at those sort of raw numbers, which can be influenced by the number of tests that are available, that we should be looking at hospitalization rates to try to really normalize how much infection there is in the community. And I think that is likely a rational approach to find out how much there is, generally speaking, in your area. As you know, we had a lot of cases in the Pacific Northwest, and so I think that truly reflected the fact that we were one of the hardest hit areas in the country to begin with.
If you did maybe have it and you didn't know, or you didn't go testing, and I've heard stories from a lot of people who said, I was just too sick to go get tested and now I feel better. Is there an antibody? Would we be able to test and know that we had it?
Yeah, there are antibody tests that are becoming available, both commercially and by research purposes. And so our health system is looking at which particular kits we should purchase for antibody testing within our health system. We also are standing up clinical trials to test our caregivers. And so the hospitals in Portland, the Providence Hospitals in Portland, just started their clinical trial to look at their caregivers, and those caregivers can voluntarily go get tested. And the results will only go back to the caregivers and to the research team. They won't get entered into the medical record. And so that's a volunteer sort of study. We're looking at doing this, adding ourselves as a site to that study here in Everett soon. And I know there's a number of other sites around the health system that are also interested in participating. So we're hopeful that we'll be able to start this testing for our caregivers locally within the next week or two.
We hear a lot of commentary about the sheltering in place and the sheltering or stay home, stay safe. Is it working?
Yeah, I think it's pretty clearly working at this point. We, within our state of Washington, had a shelter in place now over the last few weeks, and we've seen, in terms of admissions in the hospital, a flattening of the curve, and we're just now starting to see perhaps a decrease in the hospital census with patients with COVID. So, whereas before the shelter-in-place rules came into play, we were seeing pretty dramatic rises in our hospitalized patients. So, I think from our perspective, it's clearly working, and at least within the Puget Sound area, appears to be working quite well.
Is it something that we should continue to do, though, for another month or so? I mean, if people to go out right away, is it just going to take us right back to where we were?
Yeah, I think that's one of the hardest part for our political leaders, is to determine when they can start relaxing some of these rules. Certainly, I think as further testing becomes available, we can hopefully better identify pockets of people in the community that may have the infection, and that we can do targeted quarantine and isolation for those people and reduce further infections. But hopefully over the next few weeks or month, we'll be able to slowly start ramping up people being able to leave their homes. But that's certainly going to be based on a lot of data within each state, to determine when the right time is to do that. The concern is obviously that if you start relaxing these requirements, that you'll see a bump in cases. The question is, can we be prepared for an increase in cases, and can we quarantine those folks appropriately so that it doesn't become widespread?
It seems like it's getting better, or the curve is flattening on the West Coast, but we're still seeing East Coast and other states that are really growing quickly. Is that because they didn't shelter in place, or is it just because it's affecting different areas of the country differently?
Yeah, I mean, I think this is like a wave or a tidal wave that occurs, and we were one of the first ones that were hit, and so each subsequent area that becomes areas that have increasing infections, if they don't do shelter in place sort of rapidly and consistently within their population, the numbers will just simply increase very, very rapidly. And I think that's part of what's happening on the East Coast.
Well, one of the questions we got said that I'm hearing a lot that race has a lot to do with how you're impacted by COVID. What does that mean exactly?
Yeah, so there appears to be a disproportionate number of patients who are African American and Hispanic who have developed infection relative to the general population. And that can be for a variety of factors. One example, for example, within the Hispanic community, sometimes there are more than one family within a household that shares a house, or it could be multi-generational. So there's both grandparents, parents, and grandchildren living within the same house with larger numbers of people. And so when one person becomes infected in a household like that, the infection can really spread quickly across that household. So there's a number of different variables that I think accounts for this. But yes, it appears that at least those two populations have been disproportionately hit.
Well, and I also saw a question come through about it seems that more men are dying from COVID. And is it really because they had different conditions? Like men typically have more heart conditions, that sort of thing?
That certainly could be the reason. It's really hard to know, I think, with any certainty that there is a predisposition for men to have a higher mortality. And of the risk factors that perhaps are a little higher in men would be cardiac problems, and those could account for the differences that we're seeing in infection and mortality.
Well, I know you're an expert in this whole area, so help us understand, because first we saw it was airborne, then it wasn't airborne, then it was on surfaces, then it was on surfaces for 14 days. What is it? What is the current information we need to know about how it's spread and what we really need to be cautious of?
So by far and away, the most common way that this virus spreads is through droplets. So when someone coughs or sneezes, they can generate droplets with virus in there, and then the person that's closest to them can inhale them, usually through their nose, and cause infection to the next person. There's emerging information that perhaps these viruses are also becoming aerosolized, meaning that they don't require droplets. They can sort of, in very small particles, reside in the air. At this point, we're not sure exactly how much that causes transmission. One of the things that we've been doing within Providence Health has been following CDC recommendations for and WHO recommendations for appropriate PPE and caring for patients, and that's mostly involved using surgical masks and face shields for patients that have COVID. And we haven't yet at this point within our health system seen substantial numbers of caregivers becoming infected. So we believe that the protection that we're using for droplet seems to be effective. There are there's emerging information that perhaps airborne transmission does play a role here, and we're following this data very, very carefully. At this point, CDC has not recommended that we use respirators for caring for all of our patients with COVID, but that's something that we're certainly going to keep in mind over the next few weeks and months as things evolve. In terms of the environment, we know that the virus can live on the environment for some period of time, and it's important to make sure to clean the environment as best as possible, particularly in patients who are COVID positive. So we do a lot of work to make sure that the rooms that where patients have been with COVID are cleaned very, very well before the next patient arrives.
How long is someone technically considered contagious?
That's a really good and hard question to answer. I think in the vast majority of cases, people probably are not very contagious after about a week of symptoms. And so most health districts will say that you can take yourself out of quarantine 7 days after symptoms started and 3 days since your last fever. For most people would be about a week or 10 days sort of at the most. There are some people that can shed virus longer than that. And so, for example, when we have caregivers that have infection, sometimes we will require that they get tested and make sure that they have 2 negative tests before they return to work. And those are primarily in caregivers where we think they have persistent symptoms, that exceed that initial time that I had just mentioned. And so for at least caregivers, it's really a case-by-case basis. For the average person that's out in the community, a week past symptoms is generally sufficient for releasing from quarantine.
Awesome. Well, we got a question from a lot of different people that said, what if I'm pregnant and I get COVID-19?
There's not too much data on that quite yet. We would obviously prefer that women that try to reduce their chances of exposure to the virus as much as possible. Thankfully, so far, it has not been found in amniotic fluid, and it hasn't been found in breast milk. And we think the transmission to the fetus the chance of transmission to the fetus is actually pretty small. But certainly, we would recommend all the usual precautions for pregnant women and trying to avoid being in an environment where there's a lot of contact with different people. So that's one of the things our caregiver health department's been working on as well.
Wow. We had a couple of questions come in too about, can I get COVID from my pet or can I give it to my pet? Do we know?
The CDC thankfully has made a statement that pets are not generally infected. I think there was a media report of a wild animal that was infected with COVID, but I think that's extraordinarily rare. For the most part, you should not be able to transmit the infection to your pet, nor could they transmit it back to you.
Well, we've had a few people ask us how Providence hospitals are equipped to handle infectious diseases. And I know that you were more than equipped before this happened, but have anything changed? Are all Providence facilities able to handle the same level?
Yeah, so thankfully, under the leadership of Dr. Amy Compton-Phillips, our health system has a very centralized response to this outbreak, and we're making sure that every facility with our health system is able to manage patients. The supply chain is also managed centrally, and so we're making sure that each hospital has all the right equipment, staff, and expertise to be able to handle a COVID patient no matter where they come within our health system.
We also had a lot of questions about hand sanitizer versus antibacterial soap versus Lysol wipes. Is it all the same? What should we be using for what different purpose?
So hand sanitizer is the best for when you are being exposed to, like, let's say a cart, at a grocery store or something outside your home, within your home to clean your counters and things like that. Lysol wipes or equivalent are certainly very appropriate to disinfect any possible areas that there might be infection. The high sort of risk areas in a household would really most include the counters and the sinks where there's more than one person using the either appliance or sink or whatever it might be. So the high touch areas are the ones that should primarily be disinfected.
Yeah, I'm using that refrigerator door handle, Lysol, all day, every day.
Yeah, that's a good idea.
Well, speaking of kind of sanitizing, we've heard conversations happening a lot in social media about resanitization of masks for caregivers. Is that for employees? Is that something that we're actually looking at as a system?
Yeah, we have employed that as a tactic to reduce our need for PPE. The CDC did come out with recommendations for how to do it, and so we've been complying with the CDC guidelines for reuse of masks as well as extended use of masks. Obviously, if a mask is soiled or can't be used, it's discarded, but if it's in good condition, it can be reprocessed by medical reprocessing department and then put back into circulation for use. So that is something that can be done, and we are doing according to the CDC guidelines.
Well, one of the things we've been very concerned about, Dr. Diaz, is that we're hearing that there's potentially an increase in deaths from strokes and heart attacks and things where people didn't call 911 and didn't go to the emergency room because they were afraid to get COVID. It seems like it's still fairly safe given the containment that you're handling. What would you say to those people who aren't making that call?
I think that if someone has a health concern, that they should call 911 and come into the hospital. We believe it's safe. we've had enough cases of COVID within coming to our facilities that we feel confident that we can provide a safe environment for patients to come to seek care. We certainly don't want people to suffer at home for fear of not being safe in the hospital. And I can assure you that's not the case. Our ministries are well equipped to protect you from COVID while you're here.
Well, and I know that a lot of our physicians, when we had to close clinics, were repurposed to do virtual. So would virtual be an option for these people?
That is an option if it's for routine visits or even urgent visits by phone. We've really made a lot of use of our telehealth system to manage even our COVID response. And so within our ED here in Providence and Swedish and across our health system, when someone comes into the ED with symptoms of COVID and they're not ill enough to be admitted, we do have them plugged into telehealth where they get an oximeter and they go home and they're monitored from home using either the phone or video, and that has appeared to be a very effective way of managing patients. And we know that we can safely manage patients using telehealth or virtual services, and so we strongly encourage people to do that.
Wonderful. We got a question, actually, we got this question from more than one person. Can I go to a funeral of somebody who had COVID-19? And I think there's one question as to whether we should be in large group gatherings. Probably not. But I assume that by the time somebody passes and they're at a funeral home, that's not a concern any longer.
Yeah, so there are guidelines for funeral homes in terms of how to manage the dead person safely, and so that's being done. The funeral homes as well as cemeteries will have rules in terms of size of gatherings for people that are being buried, and oftentimes there won't be an open casket, and the family may not actually be able to witness the deceased person be directly buried or go into the ground. So if there are any questions, you can contact your local funeral home or cemetery. They can give you exact guidance, but at this point, it's not a forbidden thing to go to a funeral.
We did get a fun question the other day on a Facebook Live that we wanted to bring to you, which was, should I be microwaving my money, my currency, so that I can sterilize it? And does microwave actually de-sterilize things? And I think it would be safe to ask that same question for masks and other things.
We haven't been routinely recommending microwaving anything to sterilize it. I'm not sure that it actually would. And there's also concern that some of these products may actually have some metal in them, sort of buried in there. And so you'd have to be extremely careful with putting anything unusual into your microwave. So I don't think that we would recommend microwaving pretty much anything at this point for sterilization.
Okay. And you talked a little bit about how long we're contagious, but how long is the typical recovery time right now?
For most people, they will recover within a few days or a week. They'll start feeling better and be able to return to their usual activities. People that are older or have significant medical problems can take longer. In some patients who are very, very ill, who ended up in the ICU on a ventilator, for example, their recovery could take a month. But for most people that don't get that sick, usually a few days or a week is when they will recover.
We're hearing a lot about ventilators, and I know even our Providence, Oregon shipped them to New York. Why are ventilators so necessary, and why are there so few of them? In people that get severe coronavirus pneumonia, in order to survive the illness, they need to be able to have enough oxygen in their bloodstream to survive. And sometimes the only way to provide that level of support is with a ventilator. So they can be very important in patients' lives to have access to them. Thankfully, within our area as well as it sounds like in Oregon, the number of cases appears to have plateaued. And so both Oregon as well as our area are now sending ventilators to the areas of the country where they're most needed. Thankfully, we're able to do that. Wonderful. Well, I hope you've had a chance to see them, but I know you've been very busy. But we've had a lot of people sending in messages and videos and photos saying thank you to all the healthcare workers. What would you say to those people who have taken the time to say thank you?
Just to express our gratitude, from Providence. I think that the amount of support that we've seen from the community has been really amazing. We've gotten a lot of donations for masks. within our health system, we were concerned about supplies, and so we began making our own masks, and we got many volunteers from the community to help us with that. Our community partners have also made masks from their businesses, with a special shout out to Koss and Nordstrom's, who have really helped us get more masks and face shields and things like that with our hospitals. And so the amount of support within the community has been amazing. We are super grateful.
Yeah, we've seen a lot of support from Alaska Airlines and Nordstrom, as you mentioned. And I think we actually have a website, coronavirus.providence.org, where people can go and learn about how they can help. And one of those ways is donations. I mean, we're spending a lot of money to care for patients and to do research and to try the clinical trials and the vaccines and testing. And I do think it's important for people to know that staying home is the first and best thing that they can do. But the second is to really donate those masks and the time and the dollars if they can. So, Dr. Diaz, do you have any parting thoughts for everybody before we let you go?
No, thank you so much for having me on the show, and just know that we are still working really hard to keep everybody safe with our hospitals, and we're grateful for all our communities and all our staff that have been really amazing in caring for our patients and one another.
Awesome. Well, thank you, Dr. Diaz, for joining us today and helping provide these updates on COVID-19 and all of your advice. We really appreciate it. To our Providence heroes, all of our frontline healthcare workers who are working tirelessly to keep our communities healthy, we support you, and we want you to know that if you visit providence.org/easeyourway, you can see all of the resources that Providence has put together for you. And for everybody else listening, if you want more information about COVID-19, please visit coronavirus.providence.org. We know there's many mental health issues that can surface or be exacerbated during this hard time as well. Providence has created a wellness website to help the general public. The site where you can find that content curated to help physical, mental, and overall wellness can be found at coronavirus.providence.org. Thank you again.
Thank you.